Hi, I'm Daniqua,
I'm Latasha.
Yulia Brown.
and we're here to do our discussion board on Module 4. So it's a group discussion about, um,
Breathe to Heal by Ted. The
okay,
video,
Acquire breathing techniques. Yep.
yeah. And for number 1, it says, how long did it take the veterans with PTSD to improve their conditions after learning breathing techniques? And according to TED Talks, Breathe to Heal, veterans suffer from PTSD saw significant improvement in their conditioning with just 1 week of practicing breathing techniques. The rapid transformation demonstrates the power of intentional breath work in addressing deep-seated trauma and emotional distress. And so it helped him a lot with emotional distress and, for PTSD, that breathing technique, which is amazing.
yeah.
And so we go on to number 2. And number 2, who would read number 2?
Well, according to the video, who uses breath work before going into battle, and what are the top 3 benefits of intentional breath work? So to answer that question, we can always go into U.S. military and how Navy SEALs, they get their breath work done before they go into the battle. So
Yeah.
your brain kind of synchronizes your entire body, and the 3 major components are regulation of the nervous system, enhanced mental clarity and focus, and reduction of stress and emotional reactivity. So those are very important things, especially when you're dealing with a stressful situation. So as Navy SEALs, they have to be razor sharp during their operations, and when they go into combat, you have to be ready and not out of breath or having anxiety. And breath work actually does just that, help you to focus.
Right.
Okay. And then question number 3, it says, for people with high stress, should they learn meditation first or breathing, and why? The speaker emphasizes that individuals experiencing high stress should learn breathing techniques before diving into meditation. Breathe work serves as a foundation practice that calms the nervous system and stabilizes the mind, making meditation more accessible. Meditation can be challenging for highly stressed individuals as their thoughts may be too overwhelming. However, by first regulating their breath, they can create a more suitable mental environment for meditation to be effective. So I can get how they can say, breathing techniques, because they do that in labor. When women are in labor, they have to do those breathing.
Oh, we definitely have to breathe.
Okay, to calm your nerves. So it's, I think this is an interesting subject.
Yeah.
And so we'll go to
Number 4.
number 4.
It says, what emotion has an astonishing relationship with the lungs? Do you have a personal experience with this connection to, or know someone who does? So grief has a profound relationship with the lungs. The speaker discusses how individuals holding onto deep grief often experience respiratory issues such as shallow breathing, or tightness in the chest. Personally, I think we go through some kind of emotions when with breathing.
Stressed out and,
Yeah. So, grief.
Tightness in the chest is,
Yeah, and like with my mother, she's going through uterine sarcoma, and when you look at how she's handling things, that's another thing, because she's grieving over her experience and how things
Right.
turning out in her body, because usually that is a deadly cancer. So we've been battling for 9 years now.
wow.
And
Right.
thank you. And we just I've been teaching her meditation and breathing
Right.
techniques,
Okay.
and our body is really designed to heal itself when we remove the stress aspect and actually focus on healing factor.
Right.
That's right.
So that's part of it, like being aware, being present with your breath work, and get to the programming your mind to heal.
Right. Yeah.
And so we have number 5. What are your thoughts regarding the connection between a physical manifestation of anxiety and panic attacks versus the true underlying cause? And for that, we have anxiety and panic attacks often have physical symptoms such as shortness of breath, chest tightness, or dizziness. However, these manifestations stem from deeper emotional and psychological imbalances, often related to unresolved trauma, stress, or fear. While medication and coping strategies may alleviate symptoms, addressing the root cause through practices like breath work, mindfulness, and therapy is crucial for long-time healing.
Yeah.
And so I agree with that too. You know, once you calm your nerves and you're not stressed out, and everything should get back to normal. You know, breathing techniques should be back to, you know, everybody have that good day, bad days, you know.
Yeah, and number 6, did we learn any breathing exercises so that we can continue to do them and share them with others? How will we utilize the information moving forward? So we mentioned and touched on it a number of times as we're dealing with stressful situations or people have anxiety. My father in particular, he had anxiety that he started managing with a method called Buteyko, Konstantin Buteyko method. It's a very interesting technique. You sit on the edge of the chair, you literally focus on the way you breathe in and out. And I'm telling you, later on, he just completely got rid of his anxiety attacks altogether, because when people start hyperventilating or they're not in control of this function of breathing, which is actually a lot of us, I was thinking about it when even writing this, I'm like, when we think about breathing, we actually start getting out of rhythm. Because when our brain starts kicking in, it's no longer involuntary. Now we're just looking into this, oh, am I breathing right? Do I want to breathe deeper? And then you feel like it's not enough. So when you start getting into that phase, it's the same with stress, because when you are stressed out, you forget to breathe right, you hold your breath, or you just thinking about so many things. So for us as medical professionals, it's important to put our patients at ease and sometimes breathe with them. And if they're hyperventilating, just kind of allowing them to slow down and just breathe with us as we're saying, hey, 1, 2, 1, 2, and it will help them with their stress management at that level. So,
And that was the end.
Yep.
so there we go.
Thank
and
you.
that's us. Module 4.
Okay.